morning, good evening. Welcome to everyone. Thank you for joining us for Thursday morning's administrative station. We are thrilled to have you guys. I'm going to turn it over to Mary Enquist, and we'll do a formal introduction, but I will just say this is going to be a wonderful hour. Mary is an incredible person. She's inspirational, she's kind, she's thoughtful, she's smart. She is a personal mentor and friend, and I'm just really, really thrilled to have her here with us today. So thank you so much, Mary, for being here. And we're going to keep this casual and fun. Keep your chats obviously focused on the presentation, but please send through questions, and we're going to reserve time at the end for a Q&A. So Mary, I'm going to turn it over to you.
Fantastic. Great. So when Rebecca and I were connecting about the format, and it sounds like on Brain Turns, there's been lots of different formats. What I thought might be most engaging is to do that kind of casual, almost a fireside chat type of an approach. Rebecca and I have the pleasure of knowing each other very well, so figured we could do something off the cuff without a ton of preparation. But I met Rebecca back in 2013. She actually sat within the strategy planning and business development team at the point that I joined, and we were lucky enough to work together for 7 years, about 6 or 7 years, and until she kind of spread her wings and landed this wonderful job at Lenox Hill as the administrator for neurosurgery. So she's awesome, and we thought it would be fun to go through this together. So introduction, Rebecca, do you normally do that?
Absolutely.
Okay, however you want to do it.
So over the last 15 years, Mary has worked her way up the corporate ladder at NYU Langone Health, being an administrative fellow, all the way to vice president of strategy, which is the role that she currently serves. She really held progressively larger roles in revenue cycle and payment reform along the way. Prior to joining NYU Langone, Mary worked in healthcare IT and revenue cycle consulting, and as a practice manager, supporting the orthopedic surgery practice offices at Lenox Hill. So she's an alum of Lenox Hill, which is great. Mary received her Master's of Public Health at Columbia University, graduating first in her class and serving as class president. She received her Bachelor's of Arts from the University of Notre Dame, graduating summa cum laude and as a member of the Phi Beta Chi Kappa Honor Society. Sorry if I butchered that. On a more personal front, in 2019, NYU Langone's Dean and CEO named Mary the company's Working Mother of the Year, which is a tremendous accomplishment through Working Mother magazine. And we're definitely going to hear a little bit more about Mary's parenting style and how she balances parenting and career today, which will be hopefully helpful to everyone. Mary and her husband Matthew are a modern dual career household and are devoted to parents of their 2 children, Natalie, who is 9, and Zachary, who is 6. And this past year, Mary launched a website and blog focused on applied intentional leadership at maryenquist.com. So I would encourage all of you to go to that website, sign up for the newsletter. It's really fantastic content. Again, you'll get a sneak peek of it today, but there's a lot more there. It really serves as a creative outlet and a way for her to give back and help support others, particularly women aspiring to leadership roles. And Mary serves on the board of the Boys and Girls Club of New Rochelle and as a liaison to the National Board of the Boys and Girls Club of America. So just a little bit about Mary. And again, we're looking forward to getting to know her more over the next hour.
Great. Well, you see that kind of sweet Saturday morning photo from a couple of years ago. You know, as you go through your career, and I just think life in general, there's like the portrait image where you look beautiful and, you know, makeup's all done and everyone thinks like you're super profesh. And then there's the real world, right? So of course, Saturday morning, no makeup, this sitting on a tiny little stool with both kids on my knee. And that's, you know, I think what I really try to teach in the kind of, I've got a ton of employees that are just these ambitious, high potential, high performers that I have the privilege to work with in the strategy team. and across the larger organization here at NYU Langone Health, but to show up in a very real, authentic way. And you can be both. And to be honest, earlier in my career, I remember, you know, being self-conscious about being young and wearing glasses and wearing, you know, buttoned up black suits and and like, this is going to make me come across as smart and more professional and more credible. It actually, there's a depth of maturity and I think a command that comes in just learning to fully embrace your authentic self. And that's the type of leadership I try to recommit to each day in how I choose to lead and that I try to teach with the people that I'm lucky enough to work with. There's actually a ton of literature that supports that. If you look at whether it's personality assessments or scales or leadership styles, there's about 95% of overlap between your work self and your home self. People who interact with you in those different settings might use slightly different words to describe styles and behaviors. But to be honest, people are going to see that candid self, whether you try to hide it or not. So I'm of the mindset of just embrace it. And in doing so, that you actually allow others to embrace their authentic self. There's a side in my office behind it. Let's just be who we really are. And it's okay, you know, and I think looking old or coming across in a different way, I haven't found to, you know, one, it's exhausting, two, it's kind of a show, and I haven't found it to really advance my career. I am young. You know, my story has been one of kind of being like the youngest at just about every level here at NYU Langone Health. I've been fortunate enough that my age, I don't think has held me back in big ways. You know, I'm sure, you know, there are elements of it, of being youthful that can be someone's first impression of you. But I've found if you can really develop good relationships, those types of barriers fall away pretty quick. If they can trust you, if you are credible, if you're smart, if you do good work, those things really speak for themselves. And trying to kind of form an image of you that's not really you is, I would say, a big waste of time. All right, so the next slide is a bit of an illustration of the career path that you heard in my bio. You know, and I was listening to Rebecca read the bio, and again, kind of what I tried to teach in the leadership space is this is just one side. What you don't see here, if you could go to the next slide, those are all accomplishments and achievements. They're not really who you are or what you learned from from them. So with this audience in mind, I guess Rebecca and Josh reached out, I don't know, at least a month ago. I did write a few blog posts. I try to post on Mondays. I do my writing over the weekend. But there are a couple of blog posts that are geared towards this audience, which my understanding is kind of early careers or people who are still working their way through their educational path. But, you know, I think it really is about, you know, what are those building blocks? Like you might get this degree or that degree and jump into this job, but it's also about, you know, who you choose to play with, what company you keep, who kind of accompanies you on that journey, how you choose to stack them. I'm a big believer in Sheryl Sandberg's career as jungle gym, and that it's not so much of a straight linear path. You know, I do remember actually very impressionable younger me having a family friend who's a CEO or a former CEO. He's now since retired, but I just graduated with my master's and jumped into my career. I believe I was in a revenue cycle role at that point in time. And the person kind of said, well, what are you doing in finance? You know, you're not an accountant. I'd never hire a CFO that isn't, certified accountant. And I remember thinking, actually, I took it to heart and I researched, like, how could I get, an accounting degree? It wasn't what I had studied in school. Should I go back? Should I do it? Looking back on it, I wouldn't want to be a CFO. That's not, that's not what I want. But I think it was, why I share that story is a lot of times you do hear you have to do this job and it leads to that, and kind of that more vertical, straight career ladder. And that hasn't been my experience, nor do I think it's many people's experience in this more modern workforce where industries are evolving and changing. The revenue cycle was an awesome experience for me. It forced me to learn the ins and outs of all of our contracts with insurance companies. I learned how healthcare providers get paid, what they don't get paid for, that sometimes people don't understand. And why that's important is, if you're really focused on creating value, you could be chasing the absolute wrong things if you don't understand those fundamentals. So I think that was a wonderful foundation that then helped me branch into strategy. And it informed so much of what we do. So anyways, and I love this. It's a quote that I did include in the blog post on this topic. But comparison is the quickest way to suck all the fun out of the room. So especially during this COVID period where gyms are like not really available to us, I do a lot of cycling through the bike in my basement, and Hannah Marie Corbin says this often. I think it's universal across life and not just within physical fitness. But I also referenced in that blog post early on in my career reading an article that talked about how tempting it is to compare oneself to your peers, whether that's coming out of college or even high school, whatever it is for you, because looking at what happens in their lives is a little bit of a litmus test for that path not taken. And going back to this, trying to not compare, what the study ended up finding is this group of, I think it was girls that they had followed, that seemed homogeneous in college, and I talk a little bit about my own experience. We all had brown hair, we all were Catholic, I went to Notre Dame in undergrad, it's like 70% Catholic. So it was not such a diverse little friend group. But even now, a couple of decades later, you can see the diverse paths that our lives and careers ultimately took. So it's
Mary,
more than just those milestones, is what I'm trying to say.
Yeah. And I just want to reiterate, I think that concept of really knowing the business, is something that we talk a lot about in strategy and healthcare strategy. And I think also really, really translates to operations and really any career that you choose, and just the importance of really taking the time to learn the economics of what you're doing, and just kind of the foundation. And that's going to really help you be strategic later on. If you're in medicine, as Mary said, understanding the policies, understanding how you get paid, understanding the nuances to coding, it's so important. While you do practice medicine, a lot of times you are also responsible for your own finances as a doctor, a nurse, a practice owner. And so I think that's just a really important concept. And I just want to make sure that that's heard by everyone. So thank you for sharing that. Mary, can you tell us a little bit more about your career in healthcare administration, and what does that look like for you?
Sure. Okay. Do you want to go on to the next slide as well, as we dive into strategy? So I think I'll start here and work backwards a little bit, because I think one of the very first questions before you even start is, what is healthcare strategy? And you are not alone in asking that question. It's funny, I've been here for 13 years now, and I still get that question a lot, even within our enterprise. Like I remember I had both my children here, and when I had just delivered one of them, and I was making conversation with like the nurse, the postpartum nurse, she's like, "Well, what do you do? We've got one of the." She wasn't aware we had a strategy team. She didn't know what the function was, and here she's like sitting within our enterprise, and I'm sure there are probably many employees that don't know this, which is fine. But so the strategy planning business development team, we essentially are an internal group of consultants, our function like an internal group of consultants. My team is, depending on how you kind of count, it's about 27 individuals. And that spans all of the campuses that make up NYU Langone. We are based in Manhattan. We have a Brooklyn inpatient hub and a Long Island inpatient hub, and then thousands of doctors' offices and ambulatory centers. We also have 2 schools of medicine. One in Manhattan that's focused on, it's like a almost 200-year-old school of medicine. And that's, if you saw the national and international news a year ago fall, we went tuition free, and we're the first of our scale and size. And then we established about a year and a half ago another school of medicine out on Long Island on the campus of our inpatient hub that is also tuition free, and it's tailored towards underserved specialties within medicine, like primary care, OB/GYN, family medicine, infectious diseases, and the like. So back to the question, strategy. Strategy is essentially, we help visioning, and then we also help with implementation of the strategies, goals, and objectives of the enterprise. So functioning as that internal consulting firm, rather than having separate clients where you go out and work with a bunch of different organizations, we sit within this about $11 billion organization and try to help advance our objectives of the organization. So Joe Loda is my boss. If you Google him, he's actually quite an impressive guy, as a longstanding public servant. But this is something that he said to us, I think 3 or 4 years ago, that every military arm has their special forces unit at NYU Langone, and that's the strategy team. And I think what he means by that is we kind of are the troops that are sent in to figure something out and then, implement it and get it going. That's actually something I like most about the field of strategy. It's ever evolving. Our portfolio changes. Like if we look at the portfolio every kind of rolling 6 months, there's new projects that come in. There are things that kind of roll off. What I like better about being an internal strategy team versus the consulting world, and you'll see, if you looked at that career path, I did function in that role for a little while. Internally, you really can see your projects through, and you build long-standing relationships with your stakeholders. So you kind of come in and know so much of the context versus coming from the outside and you have to learn it. And when you're on the outside, once the engagement is done, you're on to the next client. Where here you're able to kind of see the fruits of your labor and the next phase and iteration where you don't have to worry so much about, a fee schedule and closing that engagement. So as I mentioned, I'm lucky enough to work with this really high performing team of professionals. They tend to be, if there was like a median age of the team, it tends to be folks that are in the first 15 or 20 years of their career. I would say that this tends to be a really good training ground for people in their careers. You can grow and develop within the team, which is wonderful, and many people do. And then there's also almost a natural point where people then go off and take on different leadership roles, either within our enterprise or in other institutions like Rebecca did. So I do think it's a wonderful space within healthcare in general. What you have on the right-hand side are some of those tangible products that we work on. So enterprise strategic planning, I talked a little bit about that. On launching and supporting large scale enterprises. So the benefit of having that internal pool of resources is the company doesn't have to go out and engage and spend, normally the markup on consultants is at least 5 times, often more. But when we have things that are coming into the organization that we really want to implement and roll out, most recently, we supported a body of work called High Reliability Organization. It was really about how do you move healthcare to be on par with industries like the nuclear power plants in terms of safety and outcomes. If you're ever have been exposed to Six Sigma, it's like, how do you reduce failure, way outside of the mean? A lot of times you'll hear it also compared to the industry of flight, that it's, how do you make healthcare as safe as it is to step foot on an airplane? Historically, healthcare has performed more like the baggage handling side of the airline industry in terms of being prone to error and mistake. So that was one example where our team kind of wrapped around a very niche expertise with a consultant, and we're able to kind of scale and implement that across the health enterprise. We do work on the mergers and acquisitions. That's one of my favorite bodies of work. There has been large-scale consolidation within the healthcare marketplace. So M&A has been, we've had 3, 2 large inpatient facilities that we went through the merger and acquisition process, and 1 home health agency merger that actually Rebecca worked on, took the lead. We support enterprise rankings, so really understanding what goes into rankings. Probably the most famous one is the US News and World Report, but there are many out there that rank healthcare facilities as well as medical schools. So our team knows the methodologies of those inside and out, and we work with leaders across the organization to make sure they understand the opportunities and are paying attention to the right metrics. And yeah, there's a slew of things. I saw one question come in on the chat feature, which is a great question about what was our role during COVID. So NYU Langone Health has actually been, like many hospitals, at the center of this global pandemic. So for us, we got our first patient kind of mid-March, and we're at the height of our surge in April. Our inpatient census now is quite low for COVID patients. We have less than 100 in-house across our 3 inpatient sites. And where we came into play is a lot of the strategy work in the portfolio, while important, could go on hold. It wasn't important, but not urgent. So particularly as the organization geared up for the response, we looked at our project portfolio and hit pause on many things to free up, again, this kind of pool of really talented individuals that could be redeployed in different ways. So the response took many forms because we have a lot of data analytic people that are just incredibly strong in that domain. We took on internal and external reporting. Externally, it was honestly the reports our team created went to the White House. We report into the CDC, to Medicare, at the city level, the county level, the state level, it was the key metrics that everybody has been seeing in the news. So when you look at those numbers, they come from somewhere. and our team was together with so many parts of the enterprise, supply chain and frontline clinicians at each place. We were the source for getting them into the portals and out. Internally, our company is very data driven. We have dashboards on just about everything. As you run the business, strategies played historically a large role. Working with our IT department on building those out. We needed to create overnight a COVID dashboard. And for a long time, our team actually had to manually put together reports that were refreshed at least daily, sometimes more frequently than that, because it was informing the response to the pandemic. Additionally, there were functions that needed support. One of the heaviest ones was what was the process around the morgue. There unfortunately were many more people dying of this disease than is usual on any given day. So it was beyond the capacity that a lot of the hospitals have. And we're not alone in this. Every hospital facing COVID is facing these types of issues, especially as the city wasn't, it's much better now, but wasn't prepared for the increase in mortalities. So nobody was coming to pick up the usual processes in terms of being able to get people who had passed away kind of to a place where they could be buried by their loved ones. That all broke down. So they needed project management around the response. So that, I think for me that hit very, very deep on the purpose behind what we're doing in healthcare, and the charge with all of it is let's do it with dignity and respect on everything we're doing, whether it was trying to support the frontline workers and prolong life and deliver life-saving treatments, or ultimately when there were patients that succumbed to the disease. What I love about working not only in healthcare but in an academic setting is we also have scientists here that are literally on the front lines developing the vaccine. We're participating not only in the Pfizer trial and the Moderna, and the study of healthcare delivery. So this was a brand new disease. Doctors didn't know how to treat it. They had a starting place, but there was no disease trajectory mapped out and what worked and what didn't work. So we were constantly learning and disseminating information about what was working and what wasn't working. So I think the healthcare industry has played a huge role, and we are lucky in strategy to kind of help support not only our scientists, but our frontline clinical workers. All right, I probably spent way too long on that slide.
Oh, no, it's great. There's actually, there's another good question that I think is
yeah.
We're spending a minute on, but how are physicians and providers included in the planning and strategy to support their needs and goals? And I think, this goes to, I know the process, at NYU called Snapshot, but enterprise strategic planning, and what does that really mean, and how are the frontline staff involved in that?
Absolutely. So it's a great question. One thing that we pride ourselves on is that we are a physician-led organization. I think that is increasingly the trend in healthcare. So our dean and CEO is a doctor. I would say 50% of our executive team are doctors. Really the only ones that are not are some of those corporate service functions like finance or legal, real estate and development, HR, communications, development, philanthropy. But we really have physicians informing and often as the decision makers of everything we do, and PhDs, scientists as well, so doctors of all sorts. But absolutely, whenever we are working on one of these projects, our internal client are those key stakeholders, and we work hand in hand with doctors, with nursing staff to inform the strategies. It wouldn't work if we did it not together. In that way, I like being able to be a non-clinical person and be so close to helping craft the strategies. I really think the magic is in doing it together. Even last night, I was working with one of our, is an MD PhD, I believe, is the background on a very neat initiative. And our team was sitting there iterating as a sounding board of, I hear your vision as this, can I articulate it this way? And I think that's such a powerful way to gain clarity, because sometimes that combination of the business acumen and the clinical or scientific expertise helps both parties. We are constantly learning because there's so much we don't know, not being experts within the field of medicine. But they're also, if you're too close to something and know too much, sometimes you need somebody to listen and repeat back to you with a bit more clarity. So it's a good mix. And inherent in what I said before, with it being a physician and scientist-led organization, if you are somebody pursuing one of those fields and are interested in the business, there are lots of career opportunities out there. And some people might do clinical frontline care for a while, pick up administrative roles along the way, and then maybe later in career do full-time, a healthcare executive job. But it really is, it's a wide open field and you can do so much. All right, so let's keep going. Conscious of the time management, I want to make sure we have time for questions. So I imagine there's a process to distribute slides. These are some of the skill sets that are important for a career in strategy. They don't all need to be present in one person, and we have all of them present in the team. So we do try to recruit a diverse workforce within strategy, and I would say that most people in the team have a cluster of some of these. It also is nice because you can continue to work to build some of the other skills, which I think most in the team are very keen to do. Okay, this again is just a flash up of kind of the work product. So as I said before, we're a very data heavy organization and team. The strategy team, we do lots of analytics. Data visualization is really important as well, so that it's not just spitting out data, but you're converting that into information, and ideally actionable information that can advance progress. Okay, so I don't think we need to spend a ton of time on this, but Joshua and Rebecca asked, if you look back through my bio, I was the director of payment reform, kind of in the heydays of the changes that came out of the Affordable Care Act. Just a little bit about what that even means. This was a timeline of NYU Langone's kind of journey towards payment reform from 2016, way before the Affordable Care Act, to present. And I exited that role in late 2013. So I was kind of involved in that middle chunk. But, I think regardless of what happens in healthcare policy in the United States, the whole balance of cost and access will continue to be a problem. So if you're approaching a career in healthcare, this is something to pay attention and know what's worked, what hasn't worked, what the intention of some of these interventions were that either worked or didn't work. It's a problem, and it will be a problem for decades to come. I don't think that it's completely coincidental that sitting in the payment reform team and knowing the ins and outs, that then my skip level boss asked me to step into leading the strategy team, because so many of those fundamental underlying problems are so present in the field of healthcare and will be for some time. So much like when we talked about revenue cycle and like learning how the business is paid, I think payment reform is an important underlying skill set that will help you do other jobs better, whether that's operations strategy, finance, but frontline care, whatever you want to do. So revenue cycle, we talked a little bit about this. This gives you a flavor for all the different parts of the revenue cycle. My role within it, both in consulting and when I came internal, was really understanding where these pieces were breaking down, where it was an analytics role, it was working with big data, and it was essentially going and fishing for opportunity, where we had negotiated value under the contract, we had rendered world-class care, but those things weren't adding up to maximize the payment that we should expect to receive for it. There actually are a number of individuals that touch the data that ultimately flows to what goes out on the bill at different times. And many times those individuals don't even know that what they're doing in the system is impacting billing. We've tried to improve that. But, you know, an example, the charge nurse in the OR, if he or she is going through and entering what supplies and implants are going to be used on a case, that informs if you have carve-outs in your insurance contract for high cost implants, that directly informs how much you're going to get paid. So if he or she is busy, the patient's ready, and they don't click at all, you won't get full payment. So this was kind of a data mining role where you had hypotheses and you would look for examples. And what I found very validating is when you found them, you could go back and rebill and recoup that payment. So I enjoyed that role. It was a really good starting role in healthcare. Okay.
Mary, you've had so many different roles,
yeah,
you know, and seen so many different parts of healthcare, which is amazing. You know, the seat that you're currently in really is a true leadership role, you know, both of the team that you directly manage, you know, and it's a very visible role in the institution. Can you talk a little bit about what leadership means to you and why you choose to lead?
Sure, absolutely. So if you do have interest in the field of leadership, there's so many wonderful resources out there. I decided to launch a website in this space at maryenquist.com that was referenced. So a lot of the materials you'll see here are up on the leadership tab of that site. I had the good fortune of going through both an internal leadership program that my company has in-house pretty early in my career. It was kind of 2012 that I went through that program. And for me, I was at a pivotal career step where I went from leading a small team. I had 3 direct reports at that point in time, and that was in the payment reform role. So I was kind of responsible for this niche little thing to leading the strategy team. At that point in time, I had about 15 direct reports. So that was a very big move. And having this leadership training kind of in that pivotal year, I think I was about 6 months in the previous role and 6 months in the new role at the point that I went through it, really helped me to be more thoughtful and also to realize there's this whole field of literature out there that you might feel like you're going through something and no one's ever gone through it before, but a lot of these growth competencies that are required at different stages of one's career are not completely universal, but that are shared and that there are kind of best practice approaches for how to work through them. And for me, that was really inspirational. More recently, I had the opportunity to go through another leadership program sponsored by my company, but it was an external program with the Institute for Higher Hallie. Higher Ambition Leadership Institute is part of the Center for Higher Ambition Leadership. And that was a really wonderful experience. To sprinkle in the human side, the year I went through ILDP, I had Natalie. The first role, yeah, I'm trying to think, I think she was like 6 months old. And then when I went through this Higher Ambition Leadership Institute, where I needed to take a train up to Boston for a week every other month for a year, Zachary was 1, I think, and Natalie was 4. So part of the inspiration for MaryEnquist.com was, how do we help leaders? You know, I've had the good fortune that I hit some of these steps early in my life. I think to some degree relative to some other leaders, and during a time period where I had young kids at home. And I felt like there was a little bit of a gap in that space, that people didn't talk about these things enough, and kind of how it all comes together. And I was getting a lot of questions of like, how do you manage all this? Like, what are you doing? So I'm so far from perfect, and I'm not espousing that I do everything right, but I felt like there needed to be like more dialogue in this space about how do you apply intentional leadership to your career, even when you're young, even when you're raising a family and adding to it. So why do I choose to lead? Through the Higher Ambition Leadership Institute, we were actually forced to really hone our purpose statement, our core beliefs. So I have them up here, I have them on the site, where I've unpacked a little bit more about how I came to this process. But for me, it's all about creating an environment that's going to nurture growth of others. I score very high on the altruism scale, and helping others is critical to me. I think many people that choose careers in healthcare share that value. So it was, for me, creating an environment where people are developed, they're motivated, they're supported to give the very best of themselves, and in doing so, make a lasting contribution towards achieving our goals, their personal goals, the institution's goals, our team goals. So that's my purpose statement. My core beliefs. So again, if you choose to explore it on my site, you can click through and there's a little explanation about each one. But I think particularly watching the time, these can be different and will be different for everybody. These aren't right and wrong statements, but I think the more that you can really articulate and understand your own core beliefs, the more you're going to be anchored in them, and will be able to better articulate them to others. The literature says like 95% of the decisions that get made by a leader's team happen when the leader is not in the room. So the more that you can let your team know what you value, what makes you tick, how you think through things, the more likely your team is going to act in a fashion that's congruent with those values. Okay, so let's keep going. I'm not going to spend a ton of time on these, but we also developed a leadership model. This is the model I developed. I've honed a bit in the years since going through this program, but I developed it as part of the program. So it's my model for leading a team. Kind of start. I use the metaphor of a marathon. It's a marathon, not a sprint. I am a long distance runner. I haven't done a marathon in a few years now, but I've done 4 in my life. And kind of this analogy of actually not only being a runner, but coaching others that are preparing for a long distance endurance event really resonated with me. So, you know, commit to ambition. You know, what's your race? What's your goal? Anchor in purpose. Why are you running? Prepare with rigor, execute with intention. And then there's always that need to stay flexible, keep up the resiliency, excel beyond expectation, you know, cross the finish line, rest, reflect, repeat. You know, that it's a learning process with teams, you know, that you might have hit it out of the park there's still an opportunity to reflect on, well, what could have gone better, so that next time around that you're even more set up for success. So this is, yeah.
I think these processes are really important, not just for people that are in strategy, but for anyone. Again, whether you're on the front line, or working in operations, or sitting in a strategy function, taking that step back to really plan and think about, what motivates you, what motivates others. I think it's a really good practice to be in. It's something that Mary really models beautifully, as you can see. But I think this applies to everyone, no matter what career you're in and what point in your career as well. So thank you for sharing it, Mary.
Absolutely. So the next model is one I developed in this last year. Not that I don't believe everything that's still in my marathon kind of model for the team and growing and coaching a high performing team, but I had my boss of almost 10 years retire and kind of came to work under a new executive, the person I mentioned, Joe Loda, in the previous slide. And for me, it was a big year of kind of stepping into my own in a bigger way. I think pre this change, I did try to show up authentically, and it wasn't that I had no leadership voice. I was probably most comfortable with my team and with colleagues at my level. For me, this was a time I needed to kind of let that show with the full senior executive team and command it with a bit more authority. So I actually did that hard work again of soul searching and really trying to put words to what I was focusing on, and kind of developed the second leadership model for self. I call it like the model for getting your leadership voice heard. The title here is "You Can't Blow an Uncertain Trumpet." That's a quote by Father Theodore Hesburgh, who is the longtime president of Notre Dame and a real mentor, leadership mentor. So this is all about head lifted, heels to the ground, which you'll see as a kind of a tagline I incorporated into my website. But it's about leading with the competence and clarity, while also projecting that humble confidence. I'm not someone who believes that humility is the opposite of confidence. I actually think showing up with both is really important. No matter what age you are, what profession you lead, you can always learn from people, and not just up. I learn so much every day from these incredible people I get to work with. So I think keeping that humility and curiosity, and being confident in the competencies that you bring to the table. Training the inner voice, that's that awful organ between your two ears. I find, for me, that's my worst enemy, is the critical nature of what's running through my head at any given point. So this is really about harnessing control and silencing that judgment. I am trained in vocal performance. I'm a soprano. I went through music school kind of concurrent with my training in healthcare administration. But we did a lot of this as musicians, of how do you get up and perform and not be self-judging the entire time. So this, I think this applies no matter what field you're in. And it's something that I've tried to bring into my healthcare leadership as well. You'll notice there are some metaphors here around singing. So resonance and placement, of course, that's part of the technique you learn as a singer, and that's why opera singers can unmiked fill large opera houses and whatnot. But here, I like the imagery of resonance. Are your messages resonating? Are you connecting with your audience? And kind of finding that common ground, almost using some themes around best practice negotiations to make sure your message gets heard. Lead from the heart, recapitulate the why. That's, going back to that altruism, I think most people that go into healthcare really do want to be good and do good. As much as you can articulate the purpose and the why, you're going to have a more engaged workforce, and people are going to give that discretionary time to go above and beyond and do their best work. It's also very much the foundation of trust. Anchoring in breath, be calm, powerful, expansive, fill the space. There's just so much we could talk about on each of these. Recognize others, graciously acknowledge those who make it happen. Another Peloton, Hannah Marie Corbett quote, someone else's success never takes away from your own. So I think really being gracious about recognition is important. And then heels to the ground. Hold on to your integrity, be gritty, resilient. What I like about the imagery of the head lifted, heels to the ground, it's you're visionary, you're thinking up there, but you're grounded in reality of what's realistic and kind of the action of what's needed to progress something and get it done. You really need both for higher leadership. I will say most people tend to gravitate more highly to one or the other. If you don't have both, you might be a big thinker, but people may not take you as seriously over time because they're like, great idea, and that's never going to work, right? If you're just too in the kind of the nitty gritty of, say, an analysis, or I feel like the opposite is you miss the forest for the trees. That also can hold you back. So I think it's finding that balance of the two. All right, so we have about 10 minutes left. I would say that anything is fair game. How about we allocate the last 10 minutes to questions and really drive it on what the audience is most interested in?
You've talked a little bit about it, but maybe just, there's questions around being a woman and a mother,
Sure.
and how do you feel that's, have you been affected by that? Do you feel like people interact with you differently?
So our head of HR, who I respect immensely, has talked about a lot of these things that make people who they are, and I think adds diversity. So, she happens to be a female. She also is, of a minority background. I think the key from her message is never let it hold you back. And don't let other people have the power to let it hold you back. I do know that earlier in career, I hid it a lot, especially when I had my first child, Natalie. I was someone who always used that lever of stay late at the office and whatever it takes to get things done. And I remember the squeeze of, oh my gosh, now she's in a daycare and the center literally closes at a certain time. And it was like, how do I do my best work when I've got a time frame, constricting me in that end? And you often hear women, it could be men too, but it's, I think, most commonly women that do the walk of shame. That basically it's, okay, it's 5 o'clock or 4:30, whatever it is when you need to go because of childcare, centers closing or schools out, whatever it is. And it's real and people feel it. They probably feel it more than their fellow coworkers are actually judging. Again, train that inner voice, but it's a real impact. It's actually part of the reason I joined the board of the Boys and Girls Club, because for me, the wraparound coverage that they have provided, at least in the school that my kids attend, is a real enabler to let working families balance it all. But I guess what you end up finding is different ways to get that work done. So one of the lessons I learned early on, I'm a bit of a perfectionist. It's not always a gift, it can be a curse. But I think it was learning when you had to absolutely hit it out of the park and when that extra time and effort really wasn't going to maybe be necessary. For example, if you wanted to get it good, but if something was going to change 1,000 times through iterations that you knew were planned, are there times you set down your pencil and it's good enough? And I think it's also knowing when you really have to, the stakes are high, you really have to hit it out of the park, and then making sure you have the support to be able to do that. I think, and our world has moved more into the flexibility of less face time, and it has to be done sitting at your desk in a traditional office, and more of like work can happen at wherever you're working from if you have the technology to support that. So that's another thing. I tend to be an early riser, and I do get a lot of work done in the wee hours of the morning. I kind of like it because my kids are asleep and there's quiet, and you find other ways to get your work done. It may look different than the way you had gotten things done earlier. But anyways, what else?
That's a fantastic answer. Thank you. I think just one or two more. You discussed it early on, but could you just repeat the degrees that you've had and maybe any internships? People are asking those questions.
The degrees I have?
Yeah, what got you to where you are, educational, and then also internships that you may have taken along the way that helped,
Sure.
prepare
I'm going
you.
to do the internship one first because I think I have a better answer for you on that. Or maybe not better answer, but one that is likely what the people are going for. So I did do an administrative fellowship. If people don't know what that is, it's a glorified internship. You work as kind of the support person underneath a pretty senior executive. So if you think about residencies and fellowships in medicine and the clinical path, they also have those for administrative types like us. Yay. But just like in a residency or a fellowship, it's basically an apprenticeship under somebody that you really admire and want to work with. So I found that to be incredibly helpful. Why? You start to learn to think like an executive. You understand what they value. You are in higher level meetings, I think, a bit earlier in career than you might otherwise if you just jumped right into an entry level role. I also love the juxtaposition of you basically get to, follow this executive around all day, and you hear, someone coming in and making an argument for why this should happen, and then maybe 2 hours later you hear someone else providing a different perspective, and you understand why that first person's wishes can't happen. So I would highly recommend something like that. I think consulting, while it wasn't an internship, was also helpful to me in a similar way as a consultant. And I was, as a junior staff consultant, I wasn't very, I was the lowest person on the totem pole, literally, in the company. But again, your clients are typically pretty seasoned execs. So you get in those meetings a bit earlier than you might otherwise. So I think that one, while I was working, I think it almost extended my internship experience a little bit. So in terms of schooling, why I hesitate there is I don't know that anyone would say, having a degree in vocal performance and going through the rigor of music conservatory is exactly the natural training for someone to be, the VP of strategy one day. That being said, I think it was probably more formative to the person and executive I am today than almost any other education I've done in terms of transferable skills. So if I think, and I did do 2 degrees in undergrad. So I had the background, it was in psychology. It was what my major was within health sciences. And then ultimately went on and got the master's of public health and health management. So I got more tailored as I went. But, I'm very much there's so much in life that's transferable, and it's about experiences, that there's no one right educational path either. I don't know if that's helpful or not, but I know I have a unique background.
Very, very helpful. And I think we are at time. I see Dr. D'Amico has logged on to get started on the next one. But Mary, thank you so much. This was fantastic. The slides will be posted. I know there are a few questions about that. And you can see Mary's website and blog is here as well. So please give that a follow. And again, she has fantastic content on there. So thank you so much for being with us, Mary.
All right, thank you for having me. It's a real privilege. Okay, good luck everybody on your own careers. I'm sure